Good afternoon. Hello, everybody. My name is Sindreet. I hope your day is full of sunshine and rainbows and hearts and smiles. Today, I'll be presenting on the topic micronutrients and minerals. So, contents for today are going to be vitamins and minerals, and we'll be talking about it briefly. So, what are micronutrients? Micronutrients are defined as nutrients required by the body in small amounts, unlike macronutrients that are carbohydrates, proteins, fats, which are needed in large quantities. So, micronutrients are further categorized as vitamins and minerals. Just a second, yeah. So, vitamins are organic compounds that are mostly obtained from diet. They are the nutrients that body needs in small amounts of function and to stay healthy. So, we know all the vitamins like vitamin A, B, C. So, vitamins is one of those topics that is, or is always going to be in every exam. I have studied vitamins for my first year exam, second year exam, third year exam, and I think for my final year exam, I'm going to study vitamins. So this is one topic I believe that is always going to be in exams. So I think we should focus more on vitamins and minerals as part of our exams too, because I think it is one topic that we leave every time for the end, but it is always in the question paper as a 5 marks question, so it can fetch you marks. So minerals are inorganic elements derived from earth, water, and food that are essential for proper functioning of animal and plant body, such as calcium, phosphorus, zinc, etc. So micronutrients are vitamins and minerals. In vitamins we have vitamin A, B1, B2, B3, vitamin C, D, E, and K. So A, D, E, and K are fat soluble vitamins, and for minerals we have cobalt, zinc, selenium, magnesium, potassium, etc. So vitamins, as I explained, are fat soluble, vitamin A, D, E, and K, and water soluble. We have vitamin C and vitamin B, that is vitamin B1, 2, B3, B5, B7, B9, and B12. So vitamin A, we'll be starting with vitamin A. So the sources of vitamin A can be animal sources or plant sources. Animal sources can be liver, fish oil, etc. And plant sources can be carrots, sweet potatoes, spinach, kale, etc. So what are the main functions of vitamin A? As we all know that vitamin A has a very high role in vision. So it maintains a healthy vision as it is a key component of rhodopsin. It plays a role in immunity, maintains integrity of mucous membrane against infections, and has also a role in cell growth. It is vital for cell development and reproductive growth. So vitamins is a group of unsaturated nutritional organic compounds that includes retinoic acid, and several provitamin A carotenoids, among which beta carotene is the most important. Its active form is only present in animal tissue. The daily requirement in men is 600 mcg, and in pregnancy and lactation it is 950, in infants 350, and children 600. So, what is the mode of action of vitamin A? For this, I think a very easy way of remembering the mode of action is this flowchart. So the mode of action is that the dietary retinal esters are hydrolyzed by the pancreatic intestinal hydrolases in the intestine that release retinol and free fatty acids. As we can see in this intestinal cell, that the beta carotene is converted into retinol and then into retinol and then is converted into free fatty acids and retinyl esters. So from the intestinal cells, the retinol is re-esterified to LCFA, incorporated into chylomicrons, and from the chylomicrons, it is transferred into the lymph. So we can see from the intestinal cell, it is transferred to the chylomicrons, and from the chylomicrons, it is transferred to the lymph. When it is transferred to the lymph, the retinol esters of chylomicrons, they are also taken up by the liver and stored. When required, vitamin A is released from the liver as free retinol. Retinol is then transported to the circulation by plasma retinol binding protein in association with albumin. The retinol RBP complex binds to specific receptors on the cell membrane. So we see that retinol binds with the retinol binding protein and it forms an association. Then, when it reaches the target cells or the specific receptors on the cell membrane of the peripheral tissues and cells, they carry the retinol by cellular retinol binding protein and cellular retinoic acid binding protein, that is CRABP1 and CRABP2, to the nucleus, and then it binds to the DNA. So, this is the entire mode of action of vitamin A. So, Wald's visual cycle. So As we see that retinol reaches the target cells, when the retinol, sorry, the all trans retinol, when it reaches the retina from the liver, it plays a role in the Wall's visual cycle. So the Wall's visual cycle, rhodopsin is a conjugated protein that is present in the rods. It contains 11 cis retinal and protein opsin. The aldehyde group of retinal is linked to E amino group of the lysine, that is of the opsin. The primary events in the visual cycle on exposure to light is the isomerization of 11 cis retinol to all trans retinal. This leads to a conformational change in opsin, which is responsible for the generation of nerve impulse. The all-trans retinal is immediately isomerized by the retinal isomerase to 1,1 cis retinal. This combines with opsin to regenerate rhodopsin and complete the visual cycle. However, the conversion of all trans retinal to 11 cis retinal is incomplete. Therefore, most of the all trans retinal is transported to the liver and converted to all trans retinol by alcohol dehydrogenase. The all-trans retinol undergoes isomerization to 11-cis retinol, which is then oxidized to 11-cis retinol to participate in the visual cycle. So if you are like me and you struggle to understand big words and linings just like this, so I guess all you need to do is learn the flowchart for this, and it is going to make your job so easy. I'm going to show the flowchart shortly. So when we in the Wall's visual cycle, we have dark adaptation time. That is when a person shifts from bright light to dim light, rhodopsin stores are depleted and vision's impaired. So we have always noticed that when we come out from the sun and we enter our homes, we feel that the entire room is a little darker than usual. This is because of the dark adaptation time. However, within a few minutes, the vision starts to become normal. Rhodopsin is resynthesized and the vision is improved. Dark adaptation is time is increased in vitamin A deficient individuals. So what happens is if you are vitamin deficient, when you're going to enter a room after you come back from bright sunlight, the time in which you're going to start seeing the insides of your house normally and not darker is going to increase. This is called the dark adaptation time. Bleaching of rhodopsin. When exposed to light, the color of rhodopsin changes from red to yellow by a process known as bleaching. Bleaching occurs in a few milliseconds, and many unstable intermediaries are formed during this process. So the rhodopsin is converted into pre-lumirhodopsin and the lumirhodopsin, and then to metarhodopsin 1 and then to metarhodopsin 2, that is finally converted into all transretinal plus opsin. So we have the visual cascade and GMP. That is when light strikes the retina, a number of biochemical changes leading to membrane hyperpolarization occur that result in genesis of the nerve impulse. The hyperpolarization of membrane is brought about by the visual cascade involving the cyclic GMP. When a photon is absorbed by rhodopsin, metarhodopsin 2 is produced. The protein transducin is activated by metarhodopsin 2. This involves an exchange of GTP for GDP on inactive transducin. The activated transducin then activates the cyclic GMP phosphodiesterase enzyme, degrades the cyclic GMP in the rod cells. A rapid decrease in cyclic GMP closes the Na channels in the membranes of the rod cells. This results in hyperpolarization, which is an excitatory response transmitted through the neuron network to the visual cortex of the brain. So this is all that I said theoretically. This is how you're gonna sum up, or if you want to learn it in a short way, this is a very easy cycle to learn about it. So what happens when there's deficiency of vitamin A? Deficiency of vitamin A can cause night blindness, that is also called as nyctalopia. This is blindness due to drying of cornea, thus damaging the retina. Xerophthalmia, drying of eyes occurs progressively further to corneal ulcers, scarring, and ultimately blindness. By Torch spot, foamy white spots on conjunctiva of eyes caused by keratin buildup. So what happens if we are having excess of vitamin A? It causes hypervitaminosis A, results in symptoms such as nausea, dizziness, headache, liver damage, and in severe cases death. Chronic toxicity can cause bone thinning and birth defects in pregnant women. What is the daily intake? In men, it is 900 micrograms of retinol activity equivalents. In women, it is 700 mcg of RAE, sorry, and in children varies by age, generally 300 to 600. So vitamin D. Vitamin D refers to a group of fat-soluble corticosteroids, a type of steroid which is broken ring, found in liver and fish oils, or is obtained by irradiating the provitamin D with ultraviolet light, and are responsible for enhancing intestinal absorption of calcium, iron, magnesium, phosphate, and zinc. It is also called the sunshine vitamin. So it is available in two forms, that is cholecalciferol, that is vitamin D3. It is made of 7-dehydrocholesterol in the skin of animals and humans, and calciferol D2 is obtained artificially by the irradiation of ergosterol and is called ergocalciferol. So the sources of vitamin D. So we've almost heard our entire life that sit in vitamin D, sit in sunlight, otherwise you're not gonna get your vitamin D. So sunlight is the main source of vitamin D. Only the exposed part of the skin gets the vitamin D. Food like fatty fish, fortified foods such as cereals, dairy products, etc. So the functions: calcium and phosphorus absorption for healthy bones, maintains the calcium levels in the bone, and fights against immunity and also regulates growth. Metabolism and biomechanical functions. Vitamin D2 and D3 as such are not biologically active. They're metabolized identically in the body and are converted to active forms. The synthesis of vitamin 1 to 5 dehydroxycholecalciferol to 25 OHD3 by a specific hydroxylase present in liver. So for this flowchart is very important. In the skin, when the UV lights hit on the skin, the 7-dehydrocholesterol is converted into cholecalciferol, which further in the liver, the cholecalciferol is hydrolyzed by the enzyme called as 25-hydroxylase into 25-hydroxycholecalciferol. Then in the kidney, the 25-hydroxycholecalciferol is acted upon by 1-hydroxylase and it is converted into calcitriol, that is vitamin D. Vitamin D also helps in calcium and phosphorus absorption. When this calcitriol reaches the bone, it increases the bone formation and turnover. And the calcitriol in the intestine, it binds with the calcitriol receptor complex, reaches the nucleus, and then it reaches the calcium binding protein, increases the calcium absorption, which further increases the bone formation and turnover. So deficiency. Deficiency of vitamin D can cause rickets, a disease that causes soft, weak bones, resulting in skeletal deformities like bowed legs and thickened wrists and ankles. Osteomalacia, a condition characterized by softening of the bones due to poor mineralization, leading to bone pain and anti-muscle weakness. Osteoporosis, a long-term effect of vitamin D deficiency is osteoporosis, where bones become weak and brittle, increasing the risk of fractures, especially in older adults. So, the excess of vitamin D can cause toxicity due to excessive supplements, symptoms of toxicity, nausea, vomiting, joint pain. The tolerable upper intake level for vitamin D is 4000 IU per day for adults. Daily recommended dose for infants is 400, while for children it is 600, and in adults it is 600. Pregnant and breastfeeding women it is 600. The treatment is sun exposure, supplements, diets, and fortified food. Vitamin E, the sources are nuts and seeds, spinach, fish, etc. The functions, it has antioxidant properties, supportive in skin, heart, and immune health. The deficiency is rare but occurs due to genetic causes leading to muscle damage and vision issues. It is cured by supplementation and balanced diet. The mode of action of vitamin D. So the free radicals such as superoxide, hydroxyl ions, and nitric oxide all contain an unpaired electron. These radicals can have a negative effect on cells, causing oxidative damage that can lead to cell death. Antioxidants such as vitamin E. So this is a very important question, will come a lot of times, that which vitamin has antioxidant action. So it is vitamin E. It prevents cell damage by binding to the free radical and neutralizing its unpaired electron. For example, when vitamin E binds to or O, they form an intermediate structure that is converted to A-tocopherol quinine. A recent population-based study of antioxidants concluded that a diet rich in food containing vitamin E might help protect the people against Alzheimer's disease. Vitamin E is the form of supplement was not associated with reduction in risk of AD. Functions of vitamin E. It is an antioxidant, most powerful natural antioxidant, free radical scavenger, protects the cell membranes, protects LDL from oxidation, protection of double bonds in polyunsaturated fatty acids, prevention of rancidity, works in conjugation with selenium. So this is also a very important question in NEET PG exams, that which vitamin works in conjugation with selenium. It is vitamin E. Vitamin E also plays a role in neurological functions and inhibition of platelet aggregation. Vitamin E also protects lipids and prevents the oxidation of polyunsaturated fatty acids. So vitamin K, it is available in two forms, vitamin K1 and K2. Vitamin K1 is leafy based while vitamin K2 is animal based. Its functions include blood clotting, heart health by preventing decalcification in arteries, and bone health by working with vitamin D and calcium. So the deficiency rare but can cause clotting issues and can be cured by supplements. So the mode of action of vitamin K. Vitamin K induced synthesis of prothrombin is a vitamin K deficient only slightly inhibited by cyclohexamide treatment. Vitamin K is a cofactor for enzyme gamma glutamate carboxylase. This enzyme is required for the post-translational modifications of protein that contain the amino acid residue glutamic acid. In so this is also a very important question. The glutamic acid and vitamin K correlation. In the presence of vitamin K and the gamma glutamate carboxylase, these proteins go through a carboxylation process that alters the structure by converting glutamate residues into bicarboxyglutamic acid residues. The functional significance of the change is that the GLA residues have a strong binding affinity to calcium. Thus, in support of blood clotting pathway, vitamin K is required for the activation of prothrombin factors 7, 9, and 10. So the isolated prothrombin does contain radioactivity if the vitamin K deficient rats are treated with vitamin K but no cyclohexamide. When radioactive amino acids were given to deficient rats 1 hour before cyclohexamide and vitamin K, radioactivity was found in prothrombin. These data suggest that in the intact rat, the action of vitamin K is to convert a protein precursor with a short biological half-life to prothrombin. So, what are the functions of vitamin K? It is essential for hepatic synthesis of coagulation factors 2, 5, 7, 9, and 10. It prevents hemorrhage only in cases when there is defective production of prothrombin. Oxidative phosphorylation. It acts as a cofactor in oxidative phosphorylation associated with lipid. Vitamin K is needed for carboxylation of glutamic residue of calcium binding transport between the flamin coenzyme and cytochrome system. Vitamin C. So vitamin C, the source, the citrus fruits, kiwi, bell pepper, etc. The functions, antioxidant as it helps in neutralizing free radicals by protecting the cells, collagen formation, immune support, iron absorption, and wound healing. Deficiency leads to scurvy characterized by gum disease, bleeding, and fatigue. So scurvy is a very important question, comes in university exams and stuff. So the functions of vitamin E. So vitamin C, sorry, the functions of vitamin C. Vitamin C acts in the synthesis of collagen, maintenance necessary for maintenance of bones and proper functioning of adrenal and thyroid glands. It acts as an antioxidant. It stimulates immune function, combats bacterial infections, reduces effects of allergy producing substances, and protects vitamin A, E, and some B complex vitamins from oxidation. The vitamin C deficiency can also cause scurvy, fragility of blood vessels, easy bruising, hemorrhage, poor healing, pain in bones and muscles, poor bone and dentine formation, and compromised immunity. Vitamin B1. So now we are at vitamin B1, that is thiamine. Sources are whole grains, pork, red meat, nuts, etc. The functions are energy production. Thiamine is crucial in converting carbohydrates into energy, which is especially important for brain and nerve function. The metabolism. Thiamine is essential in metabolizing fats and proteins, ensuring that cells receive the energy they need to function. nervous system support. It plays a key role in nerve transmission and muscle function and helps maintain the health of the nervous system. So, what can the deficiency of vitamin B1 cause? So, it can cause beriberi. We have two types of beriberi, the wet beriberi and the dry beriberi. The symptoms of dry beriberi include peripheral neuropathy, muscle weakness, gait, ataxia, paresthesis, and Wernicke's encephalopathy. And in wet beriberi, we have high output heart failure, heart hypertrophy, tachycardia, dyspnea, edema in the lower extremities, and lactic acidosis. We can also have Wernicke-Korsakoff syndrome. So this is also a very important NEET PG question that with which vitamin deficiency causes the Wernicke-Korsakoff syndrome. So it's vitamin B1. This is a severe neurological condition often seen in alcoholics, leading to confusion, memory loss, and lack of coordination. So its treatment is the use of supplements. Vitamin B2 is riboflavin. Its sources are dairy products, meats, and vegetables. The benefits. Energy production. It assists in break down nutrients to create energy, has antioxidant property. It helps to protect cell from oxidative stress, skin and eye health. It supports the healthy skin and reduces the risk of cataracts. Growth and development. It is important for body growth and red blood cell production. Its deficiency is rare but can lead to cracks or sores around the mouth, swollen red tongue, sensitivity to light, and eye fatigue, dermatitis, and anemia. Vitamin B3, niacin. So the sources of niacin include animal products, whole grains, nuts, and seeds. The functions are energy production. It helps to convert food into energy by aiding enzymes in the breakdown of carbohydrates, fats, and proteins. Cholesterol regulation. High doses of niacin may help lower LDL cholesterol and triglycerides and raise the HDL, that is the good cholesterol. Skin health. It also supports in having a healthy skin. So the deficiency of niacin can cause condition called pellagra. So it is also a very important NEET PG question that what are the three Ds of pellagra? So it is dermatitis, diarrhea, and dementia. So dermatitis, there is rough scaly skin often in areas exposed to sunlight. There is diarrhea, there is dementia. Dementia is mental confusion, memory loss, and even hallucinations in severe cases if left untreated. Pellagra can be fatal. So vitamin B5, it is called the pantothenic acid. So the sources of pantothenic acid are chicken, beef, milk, yogurt. The functions of vitamin B5 include energy production, stress response, and wound healing. The symptoms of deficiency include fatigue and weakness, irritability, and mood changes. Digestive issues such as abdominal cramps, nausea, vomiting, numbness, burning sensation in hands and feet, also known as the burning feet syndrome. So this is also a very, very important NEET PG question. Has been there a lot of times that what which vitamin is associated with the burning feet syndrome? It's vitamin B5, the pantothenic acid. So deficiency causes headache and muscle cramps. Vitamin B7 is biotin. Its sources are egg yolk, legume, whole grains, etc. The functions are metabolism support. It helps enzyme break down fats, carbohydrates, and proteins for energy production. It helps maintain the hair, skin, and nail health. It supports the growth of health of hair, skin, and nails, often used as a supplement to improve hair strength. Nervous system function. It supports a healthy nervous system and cognitive function. Gene regulation. It plays an important role in gene expression, helping to regulate the cellular functions. So deficiency symptoms are hair loss or thinning hair, scaly red rashes, especially around the eyes, nose, and mouth, brittle nails, fatigue and lethargy, depression and cognitive issues, numbness and tingling in the extremities. The dosage is 30 mcg. Vitamin B9 or folate. The sources are dark leafy vegetables, grains, cereals, etc. The functions are DNA synthesis and repair, essential for the production and maintenance of new cells. Red blood cell formation helps prevent anemia. Brain health supports the cognitive function and may help reduce the risk of depression. Heart health, it can help lower levels of homocysteine. Pregnancy health, critical for the fetal development. So, deficiency of vitamin Folic acid deficiency can cause megaloblastic anemia. It is characterized by large immature red blood cells, can cause fatigue and weakness, pale skin, shortness of breath, mood changes such as irritability and depression. Folic acid supplements are commonly recommended for women who are pregnant or planning to become pregnant. It is generally considered safe, but excessive intake from supplements can mask the symptoms of vitamin B12 deficiency. Vitamin B12, cobalamin. The sources are animal based foods. The function is red blood cell formation, that is essential for production of healthy red blood cells. DNA synthesis for the synthesis of DNA. Nervous system health supports the maintenance of myelin sheath. Energy production, role in metabolism of fats and proteins. Mood regulation may help prevent mood disorders. Deficiency, megaloblastic anemia, characterized by the production of large ineffective red blood cells, fatigue and weakness, neurological symptoms, glossitis, and mouth ulcers. Supplementation, recommended for individuals at a risk of deficiency, such as vegetarians, vegans, the elderly, and those with certain medical conditions affecting the absorptions, like pernicious anemia or gastrointestinal disorders. So in minerals, we have the macro minerals that are calcium, magnesium, potassium, phosphorus, and trace elements like sulfur, iron, chlorine, zinc, cobalt, copper, molybdenum. So calcium is the most abundant mineral in the body. It is located primarily in bone tissue and in teeth. It is a vital essential mineral. The sources are dairy products like nuts, seeds, fish, etc. And the daily requirement is 100 to 1200 mcg. Role of calcium. So calcium plays a really important role in bone and teeth health. About 99% of body's calcium is stored in bones and teeth, where it provides structure and strength. In muscle contraction, it is necessary for muscle contraction as it facilitates the interaction between actin and myosin. It helps in blood clotting and also in nerve transmission. So the deficiency can cause tetany, low calcium levels along with vitamin D deficiency. Symptoms are muscle cramps, numbness, spasm of facial muscles. Also, it can cause rickets and osteoporosis. It occurs in chronic deficiency because the calcium and vitamin D levels are sort of correlated. So, low calcium levels can also cause rickets and osteoporosis, and the symptoms include bone pain, bowed legs, delayed growth, weakened enamel, hip and spine fractures in advancing age. Excess of calcium due to supplements causes kidney stones and digestive issues. Magnesium. It is essential for membrane transport systems, signal transmission in over 80% of bone and skeletal muscles. The sources are legumes, nuts, bananas, etc. Daily requirement is 40 to 60 mg per day, and further in adults, that is 200 mg per day. The role it contributes to bone density. It is vital for ATP production and maintains steady heart health and BP regulation. Low levels of magnesium can lead to symptoms such as muscle cramps and spasms, fatigue and weakness, nausea, loss of appetite, numbness and tingling. Excess magnesium, usually from supplements rather than diet, can cause side effects like diarrhea, nausea, and abdominal cramps. Potassium, it is very essential for human health. The sources of potassium are sweet potatoes, beans, watermelon, Swiss chard, cooked spinach, salmon, etc. It helps in fluid and electrolyte balance, transmitting nerve signals in muscle contraction, BP control. In oral health, it maintains the bone density and nerve sensitivity. Symptoms of symptoms of potassium deficiency include fatigue, muscle cramps and weakness, irregular heartbeats, digestive issues such as constipation, numbness, or tingling sensations. Phosphorus, the vital nutrients of body, the key role is phosphorus is a critical component of bone and teeth, making up about 85% of phosphorus in human body. It combines with calcium to form hydroxyapatite. It is a key part of ATP production, essential part of phospholipids, and is a component of nucleic acid and helps in acid base balance. Phosphorus in oral health. So phosphorus is crucial for dental health for several reasons. It helps in enamel remineralization, as phosphate ions play a significant role in remineralizing enamel, helping to prevent tooth decay. In bone support, in pH regulation, phosphorus helps maintain the pH balance in mouth, which is important for preventing enamel erosion and supporting overall oral health. Symptoms of deficiency include weakness, fatigue, muscle weakness, loss of appetite. Trace elements are sulfur. So sulfur sources are lean vegetables, cruciferous vegetables, meat and seafood, eggs, nuts, seeds, dairy products, etc. It helps in protein synthesis, has antimicrobial properties, helps in detoxification. Symptoms of sulfur deficiency include muscle weakness, fatigue, joint pain, impaired immune function, and delayed wound healing. So iron, it is the most abundant trace element. It helps in oxygen transport, energy production, immune function, DNA synthesis. Symptoms of iron deficiency include fatigue, weakness, pale skin, shortness of breath, dizziness or lightheadedness, cold hands and feet. Chlorine. Chlorine helps in the electrolyte balance, digestion, acid base balance, nerve function. Used for oral hygiene and disinfection in dentistry. Deficiency causes muscle cramps, weakness, and dehydration. Zinc. Second most abundant trace element. It plays a key role in immune function, wound healing, DNA synthesis, taste and smell. Deficiency causes malabsorption disorder. In oral health affects plaque control and taste sensation. Cobalt. It helps in RBC formation, nerve function, vitamin B12 component. Cobalt deficiency is rare and is linked to the deficiency of vitamin B12. So this is also a very important NEET PG question, that which mineral's deficiency is linked to the vitamin B12? It is cobalt. Copper. It plays a role in wound healing, bone health, connective tissue formation, taste sensation. Deficiency causes malabsorption disorders. Molybdenum. Molybdenum, the metabolization of sulfur compounds, which may have implications on overall health, plays a role in antioxidant properties for enzymatic functions. Its deficiency causes increased sulfite levels in the blood, which can lead to toxicity, causing headaches, nausea, or other allergic reactions. Conclusions. So, the micronutrients and minerals are the essential components of a balanced diet that play a crucial role in maintaining overall health and well being. Each micronutrient, whether it be minerals or vitamins, has a specific function that contribute to various psychological and physiological processes, including immune function, energy production, and the maintenance of healthy tissues. So, my references were the textbook of biochemistry by Satyanarayan and the Sheffer's textbook of oral pathology. Thank you so much for listening and giving me your precious time. I hope that the PPT helped you in some way and you'll note down the previous year questions and it would somehow help you a little bit in reaching towards your goals and in whatever you want to achieve in life. Best of luck to everybody and thank you for listening.